Today's day 6 of documenting our journey of bringing back hair and restoring people's confidence and how people see themselves. So what did we do today? So today was actually a female hair transplant procedure. This is someone who was concerned about thinning and receding at her temples and thinning and receding at her frontal hairline. So it was really emotional for her. So we were able to do a really nice FUT strip hair transplant procedure and add a lot of density to fill in the temples, fill in the hairline. Very natural, very age appropriate, and will give her a much fuller appearance. In addition to that procedure, we also saw patients for PRP, and we did several PRP procedures in the office today. And PRP can be very helpful in helping to maintain someone's hair. It can also help to thicken their hair, so it restores their hair. And I think it's a very good option for men and for women. A lot of times in conjunction with other medical treatments as well. And I think it gives a full, complete treatment modality to these patients. So I think it can be really helpful. I also saw a patient who had some scarring in the scalp, and this was from a previous surgical procedure, that they had a couple areas of scarring that was really emotional for them and they couldn't hide it. So we're going to actually transplant hair into those scars. And hair does take in scar tissue. It can grow. It may not be as dense as non-scar tissue, but hair does grow in scar tissue as long as there's blood supply, which usually there is. And we test that beforehand. And it really helps to camouflage the scar, and it makes a big difference. We saw follow-up patients who were ecstatic about their growth after a year. We see them at 6 months and a year. 6 months, patients are really happy, and I tell them there's still more to come. And then we see them at a year. So we saw those patients. We saw the immediate post-op patients. So we saw a variety of follow-ups. And then there were new consults as well, discussing different hair restoration modalities, techniques, discussing FUE versus FUT. These are things I discuss every day. So this was a really busy, full day. And it was a great day in talking to patients, discussing hair loss, discussing hair restoration, and really tackling the emotional side of hair loss. And it was a really successful day. And I enjoy what I do.